Welcome to Black Women's Health. My name is Dr. Rahman. I'd like to take a few moments before the start of this podcast to remember the former Texas U.S. House of Representative Eddie Bernice Johnson. Ms. Johnson initially wanted to become a physician but was advised by her high school counselor that she could not become a doctor because of her gender. She subsequently went on and became a certified psychiatric nurse before being elected to the U.S. House of Representatives. She served as a representative from 1993 to 2023, becoming the first woman and the first African American to hold this position since the Reconstruction. Her passing is a sad moment when we think about her major accomplishments throughout her life. However, it's also distressing to note that her family has had to file a medical claim of medical negligence related to her care in her final days. This podcast and subsequent podcasts will focus on help, what we can do to become better stewards of our health. We will start with an interview with a patient as she describes her search for Black doctors, her difficulty, and her success in what she has done in order to optimize her chances of finding a Black physician. Good morning. How are
Good
you?
morning. I'm good. How are you?
I'm very well. I have the distinct pleasure of being able to speak with Marie Jean this morning about a very important topic. And that has to do with trying to find a Black doctor, the scarcity of the Black doctor, um, difficulties encountered from the perspective of a quote unquote Haitian. Okay. So, yeah,
Yeah.
yeah.
So when it comes to that, I think that's why we don't see too many, or if there is, we don't know how to get to the doctors because there's an empathy that comes with, well, in my experience, that has come with once I finally got a doctor that was of African American descent. I found myself the first time I had my doctor was in Houston, and that was a Black doctor. And then the first meeting, I was just sitting there trying to explain. She was like, she had to stop. She was like, "Yeah, I get it." Because I was so used up until now to explain, no, this is what it is. No, like I was almost like I'm going into war for my own health prior to her. But she's like, "Yeah, I get it.
So
I
now
have,
she was of African descent, correct?
yes,
What about
yes."
your other doctors? Or did that not matter as much because at least you had one?
I tried to get as much of the others as possible, but when it comes to, let's say, if I need to see an endocrinologist, it doesn't necessarily have to be. Uh, I couldn't find one at the time,
Mm-hmm.
so I went with who I had, and then from there, they just took the test and issued based on their specialty. And then I worked with her, with my main doctor, in regards to understanding, okay, this is what these medications, how they will impact, and these are the side effects. And also reminding that it's eating and habits, all the habits, not just eating, but activities and things like that.
Did you
I,
feel that, I didn't mean to cut you off, but did you
no,
feel
you're
that the
fine.
other doctors weren't explaining as well or weren't taking as much time as this particular doctor? Or,
I just felt like there were more of Where I experienced was that if I said the side effects were a little bit more harsh than what the medication would typically describe. For example, if I'm supposed to get dizziness or something, my dizziness was always, if I felt like, no, it's not just dizziness, I get cramps too. Is that a thing? Well, I don't know. Cramps may not be that, and it was always dismissed as though I don't know what I'm talking about, or maybe what I think it is not what it is. And I'm like, no, I feel pain. It's extra pain. Or
So
they dismiss my tolerance.
this is when you're talking to a doctor that's not of African descent. Is this what you're saying?
Right. I was told to, well, you're going to have side effects. Just deal with it. Give it more time to get over the side effects. But when the side effects never went away, it was just like, well, and then one time was actually told, well, if you're not going to take my advice, go find someone else. I was like, okay, okay.
That was the right thing to do. That was the right
Yeah.
thing to do. Yeah.
I didn't even get mad because it's one of those, I'm one of those people like, just be direct with me because when I see you in the hall with other people, or like when you're greeting your next patient who doesn't look like me, the greet is completely different as opposed to me. I
Mm.
don't know if it was because I was in Texas or if it's just how they were, but then comes to find out they were not from Texas. They were from New York in Texas. So I'm like, huh. Yeah. So I don't know if it was a bedside manner issue because there's that. Some doctors just feel, well, I'm a doctor. You should just trust my opinion on this, regardless of your side effects. That has been my experience. So, and then, but you, when you go finally find doctors who, and it wasn't just because when I got to Ohio, there was one doctor and she was Caucasian, but I don't know if it was because she was of the LGBTQ community that she was more empathetic towards
She
my
was a minority too.
yes,
Okay. Minorities United.
yes. I think that's where the fears go away. How I think that's when I would say the pigment layer kind of like thins out when it comes
Mm,
to the empathy because they
mm.
can start experiencing some of the things you experience because in theirs is their sexual orientation. So they experience the suppression because I feel like once you experience suppression in any type of way, then that's when your empathetic sensors are deepened and strengthened. And
That's
that's how I
interesting.
believe
That's
a
interesting.
non-black person can relate to a black person. Is when what is your, what is your setback? What, like you said, what is your minority? Is it your intelligence? Is it your medical? Is it a medical situation or is it a decision? And some women, if they come off as though they might be mixed, even though they're not, because there are some white women who have darker features, so, and because of what they experienced, they could just be a little bit more empathetic, or they've been exposed to other cultures, so they're a little bit more empathetic. So you get that from them. But
I,
one who's
I'm gonna flip it a little bit because I hear you saying that it is possible to
Mhm.
have a non-black physician who can be empathetic, but usually they identify with some disadvantaged or minority group, or that's an
Yes,
experience. Have you encountered a black doctor that you cannot relate to, or has not been able to relate to you, or you did not have that same type of sympathetic?
not yet, because I haven't. It's only been a handful of black doctors I've had.
Hmm.
in different, like a black dermatologist, PCP, OB, and for the most part, they've all been, no, let me tell you, they'll be the ones to say, hey, this study, yes, it works, but the basis of the people they tested on were not us. So
Mm,
it's a possibility your side effects might be slightly different, if
mm,
at all,
mm-hmm,
because there weren't enough of you being tested to find out how it impacted you as opposed to them.
mm.
But it's only I haven't had it's of because I'm 42, about to be 43 next week.
Oh,
So only what since 18, I would say. So of from 18 to now, I haven't had that many black doctors in my opinion, to sample. You know how you need
are
samples
you
to
saying that's because you really
observe.
haven't needed doctors, or are you saying I just haven't been able to find them?
Haven't been able to find a lot, like because even when I go to blackdoctors.org, sometimes when it comes to certain, like if I was looking for a nephrologist, they're like, sorry, there's no black nephrologist in your area. If you're willing to travel, we have them in this state. It's just like, yeah, but does that make sense? Every time I need to go see to do my nephrology test to drive 5 states over, like, so
Let me
that
ask you
that that
this.
wasn't.
This is a thought. Well, the other big piece is that the majority of doctors are no longer self-employed. Most
Yes.
doctors are part of a hospital system,
Yeah, network.
and that often will decide where they can practice. Yeah.
Right, because I'm sure from my understanding there's costs for them to be in multiple networks.
Well,
So
I
for
mean,
some places, I
so
think.
if I'm so let's say we're talking about Philadelphia because I have a better
Hmm.
sense of that. You have
Hmm.
major healthcare systems. You have the
Hmm.
University of Penn, you have Jefferson, and you have
Hmm.
Temple. Those are like the
Hmm.
three
The
big
top three.
ones, right?
Hmm.
Um, and if you are part of a system, and this is where it gets harder for people that are looking.
Hmm.
If your doctor is part of Jefferson's system
Hmm.
and that doctor happens to be Black, but Jefferson doesn't highlight that, you would have a hard time figuring out that Jefferson actually has a Black nephrologist that you're looking for.
Right, because you can't just go by name alone.
Right. Sometimes you can go online and they may have a picture,
Hmm.
and that's helpful, but it's not always easy to find Black doctors.
Right.
Whereas in the past, where doctors were more like small businesses,
Hmm.
we had to socialize with other doctors so that we would know about you. So when their patient needed someone that practiced in your specialty, they would remember you and send that patient to you.
Yeah.
All of that has changed. And
Yeah.
so what can we do?
Yeah, it was a little bit more difficult, especially finding in Philadelphia because of how things are structured in like that network that you say. So it wasn't necessarily an individual. So when I went through Aetna, because I normally go through the insurance first
Mm-hmm.
because who's in network, out of network type of thing.
Mm-hmm.
Here it was more they'll say, oh, well, your options are limited as to what to filter by. So that's one. And
Can
then
you
comes to
filter
find
by
out that
race? Can you filter
no,
by race?
no,
Yeah. You can filter
no,
by
you cannot.
sex, correct?
Yes,
Okay.
but not by race. So, and most of the time for the Aetna platform, they don't have pictures. When
Hmm.
I was in the depending on which state I was in, some of them did have pictures, but it wasn't consistent. So it was still difficult because then I would go. take the information from the insurance company, go on and Google to see what I could find in regards to how this doctor looked like. Because after my experience with Dr. Vincent back in Houston, that was the first black doctor I had there. After my experience with Dr. Vincent, it became I was adamant to try to like, no, they have to be out there because I'm out here. I think it's just more like, in my opinion, I'm wondering if because they don't want to be stigmatized as a black doctor, they just want to be seen as doctor. But the
That's
thing
true.
is, so because of that, they may not want to put their picture. Because what also happens is, as I'm looking for the black doctor, a white person might see them in the network and be like, well, I can't go to them. They may not understand or relate to me.
Yeah.
So they're getting the counter experience with the white
That's
people.
interesting. I think there's a lot of different factors in play, but one tends to be once that Black doctor is known, they can get inundated with Black patients.
Hmm.
And it's not that they don't necessarily want them, it's just that there's a volume overload. And that's compounded by the fact that unfortunately, because of the way things are,
Hmm.
when you get a Black patient, that patient may have more complications and more comorbidities and more risk factors, which makes the care of that patient that more challenging. And
Hmm.
so it's a really mixed bag. I think all doctors, especially since COVID, have been overworked and stressed out, and are probably functioning at their peak. And then to hear we have all these Black patients that want to see you, it's like
You're
really?
already exhausted.
Yeah,
Not you're beyond exhausted. You're
right,
depleted. You're deflating
right.
actually.
And
And then
so
they're
I
like, oh no,
think
there's more.
Yeah, I think the answer obviously would be to have more Black doctors, but that's a process and that's expensive. And we've already talked about school and the cost of education, right? But now
Hmm.
we're seeing this increase in, they used to be called mid-level providers, but now we're all just health providers. Those are physician assistants and nurse practitioners. And
Hmm.
among that group, there tends to be a greater percentage of Black.
Yeah, black nurses and yeah.
And so the question is, I mean, are you comfortable? Would you be satisfied with seeing a Black physician assistant versus a Black doctor or a Black nurse practitioner instead of a Black doctor? Or is it all equal for you?
For me, um, I I am open to my work. I'm open to if they're well versed in my thing is the whole PCOS thing.
Yeah.
I
How do
need you
you
to
how do you know
understand
that?
it.
How do you judge a
I
doctor?
asked. I literally asked when I'm making the appointments, like, are you guys familiar? Is your office familiar with this condition? Like, do you, without telling me, oh, patient X name or
Mm-hmm.
et
Mm-hmm.
cetera,
Mm-hmm.
if I dropped in the word PCOS in there, you just like, what is that? Then for me,
Mm-hmm.
it's a it's a no because my past experience with that hasn't been good once they
But
first say that.
but when you
But
say that, the chances are the person you're talking to on the phone is not the doctor or the nurse
no,
practitioner.
I'm talking about the nurse themselves, like
Mm.
well, making the appointment By the time I'm calling in to make the appointment, I've already done enough research to see whether or not it's listed, they have an understanding of it. I'm not one of those like somebody just give me a referral, I just call and do it. I actually go outside. For example, for Jefferson, I'll see what they listed, but I also go and do Google research and go into different other medical sites to see, because sometimes it's not just listed OPCOS or polycystic ovarian, but if they have cystic ovarian, something along the lines of that, or fibroids and things of that nature, if they have that listed as part of their specialty, in my experience, they'll have a better understanding of my plight.
Mm,
So my care will be I will receive a more empathetic care
mm,
as opposed to not.
mm,
So by the time I'm making the appointment, yeah, sometimes I've asked, even to be honest, even the front person receptionist, unless they're new, but if they've been there for more than 2, 3 years, they know the type of patients because us women, when we get to that office, we'll talk to to our, at least for me and some other people I've seen. Once you start going to your doctor, they're part of the family. So just as with the receptionist, if you have a good receptionist and you have a good person, and I always say I'm chicken when it comes to needles.
mhm,
So I always have a spiel. I'm like, I have rolling veins. Please be mindful because I've had experience where someone didn't take that seriously and I ended up having hematoma because they put the needle, then started fishing for the
mhm,
vein because they couldn't find it. And then it didn't come up after, but it was my left arm. But it, by the time I got home, it started being purple, blackish, and then it was bubbled. So then I had to go make an appointment with my PCP just so they could see what was going on, making sure like there wasn't an infection under there and things like that, all because someone wasn't mindful of the fact. I'm like, hey, I'm not just being dramatic here. I
mhm,
have, if you don't know how to pull this blood, I already don't like needles, don't do it. I'd
mhm,
rather you go find somebody else.
mhm.
And that also took for me to be vocal about that because
I
since that
think you are
experience,
doing a number of things that make sense. You are you're going to your insurance directory.
hmm
You are Googling independent of what you find. You are
hmm
calling and researching. So you're doing due diligence. You
yeah,
are trying to make sure that the doctor that you choose will be adequate,
yeah,
and you're trying to determine that before you actually step into the office.
yes, because time is money.
Time is money. That's right. And
And
I
it
don't,
could be life or death too, because I don't want to find out after the fact because I have friends who shared their horror stories about they're like, oh, I didn't see the importance like how you see it, so I just got the best care. They're the specialty and they're a specialty doctor in their field, so they're specialists, so they approached it like a specialist is a specialist. It doesn't matter the pigment of my skin until they were in the delivery room and started questioning whether they're about to lose their life because of the fact they have a darker pigment than, you know what I mean? So, yeah, I have friends who just like, oh, my experience was, had I known better, I would have, you know, now I have to, because even with the story, what's her name? She was on Project Runway as one of the judges. She explained about that too, where
yeah, yeah,
ha,
yeah, I hear you. And I think life is not fair. And at some point, you have to understand that as a person of color,
hmm
there are certain things that you have to do to help ensure that you'll get the kind of care that you want. And the
yeah,
other thing that you said that was so right on was that when the doctor said, "Well, then you should go somewhere else." You were like, "I totally agree." That's exactly what I should do because this is not the place for me, or feeling that you just have to accept whatever comes your way. And
Right.
that's not the case. Or appreciating that if a non-Black person can identify somehow with the plight of the minority, you might get
Mm-hmm.
some empathetic care.
Mm-hmm.
So I think they're just strategies, unfortunately, strategies that you have to have um, in order to take care of yourself.
Right. And you might get it even within, because one of the things before calling you to set up the appointment, right before, because that morning work was, because I work from home, I work remote. So that morning work was a little bit slow for me. So that's why I took that morning to just focus on, let me start, having the fingers do the walking and calling and stuff. Right before speaking to you, I called one group that was, even though I'm in Northeast, they're, I think, in Albany or near, like you going towards Mount Airy.
Mhm.
They may have an office over there. And so, and they're supposed to be focused with the Black community and things of that nature. So I called and I was like, listen, I'm trying to make I would like to see, I just assume because they're focused on the Black community, they already have Black doctors because the woman who set up the place, from what I saw online, was African American. So I just assumed, I was like, yeah, so I I said I recently moved back to Philadelphia and I would like to know if you are accepting new patients for both the OB and the PCP. And I think I also need an endocrinologist because of the complication that, like, those are my three staples to start with. I have other things, but I'm like, let's start with that at least. But then the lady on the phone seemed just like, oh, it was like, okay, well, why is it that you need specific? And I was like, yeah, and I need them to be specified. Are they knowledgeable or well versed in understanding PCOS? It was like, oh, that's just your OB you need for that. I'm like, going back to, I'm like, yeah, well, that's it. I was like, yeah, but my previous doctor already explained it has to be. No, you're right. The OB is the leader when it comes, OBGYN is the leader when it comes to the PCOS part because that's the region where it's the source of it, right? Or whatever you want, however you want to say it. However, those other two have to be teaming and knowledgeable in that, in PCOS or in that understanding as well, so that it has to be a team effort. So I was like, yes, you're right. But I also need the other ones to also be versed, the PCP and to also be versed in that. So in explaining that, I already heard over the phone. And I was just like, so does that mean, but I'm one of those just like, is that a yes or a no? Like, the nonverbals, I clearly hear it, but I need you to verbalize. So I'm that girl who's gonna be like, so is that a no? Is that, will you get my information and will not come back to me? So can you confirm or deny? I'm that person. Like I hear it. Okay. I hear some sense of does that mean F off? Is that what you're trying to say? Is that, I'll be the one to be that. But so then I'm like, so is that possible? Can you get my information? At least give a call back. I've yet to hear a call back.
Do you think there is some sort of social obligation for Black doctors to make themselves known to Black patients?
I would love it.
Do you think
I
uh,
think there's a perspective. There's one perspective that yes, there's a need for it in one perspective. And I think the reason it's not happening is because of what you explained, that their doctors in general are already depleted. And then when you expose them to that, it's like you're exposing them to the masses and they're already over capacity.
Mhm.
And physically and psychologically deflated, because it's a lot. I,
Mhm.
it's a lot. Once you get, it's like, I get that. But at the same time, I think if more Black folks knew there were more, it's right now it's a lot because we know the community may know of those 10. They know of 10, but in reality, there's 100.
Yes. Yes.
Had the 90 stepped up, the 10 wouldn't feel so, I think,
Yeah, that's a
stepped up in the sense of coming out from the
yeah. I
shadows, or
don't know
or
if
just
that's
saying, "Hey,
really
I'm here
true,
too."
but
I
you're
don't know.
right. I
Yeah,
think, you may know of one or two, but the reality is there may be 20 or 30, right? And but the question is, and this is the part that's not clear, even if you know of them, they may not be in your network. You know, they may not take your insurance, and there are all these other confounding factors. So the question is there a real benefit to knowing, I guess?
I think so because the thing is, I believe Black communities, regardless of whether it's Black American, Caribbean American, African American, Central American, whatever, you know, the Black communities, Jasper, in the United States predominantly go through word of mouth
Hmm.
and opinion of each other. Because it's one of those, and it's also, once you get to that, then there's that other subculture of like-mindedness.
Mm-hmm.
So, like, from my friends and I, we can recommend, oh, hey, you having this experience. I know this network. Maybe you could go
Mm-hmm.
consider this. Because that's how I was exposed to, they're like, oh, I go to Jefferson. Or heck, we graduated from Temple. I just stayed with Temple and
Mm-hmm.
dealt with it that way. And then from there, then you'll get, oh, well, my mom have always been going to so and so doctor.
Mm-hmm.
Most times people may just go to that doctor even if they're out of network. If they some if they can afford to, they
Mm-hmm.
rather,
Mm-hmm.
because of the sense of feeling safe.
Mm-hmm.
Those who can't afford it, if they knew of the ones that were within their network, it would be best for them too. Because, okay, for example, Dr. Z may not be in my network, but Dr. Z will be in Jennifer's network.
Mm-hmm.
So Jennifer's also looking for a Black doctor, but I can't go see Dr. Z, but she can. So, and since I talked to Jennifer, and I could be like, well, I went through that. And she was like, oh, and I couldn't see him. Oh, he's like, oh, wait, I have so and so.
Right.
And
Right.
then he was just
Right.
like, oh, yeah, they're as cool as so and so said, because Deborah said Dr. Z. It all started with Deborah, you know what I mean?
Mm.
Because Deborah's grandmother has somebody who's been going to Dr. Z type of thing. So, because of that word of mouth that still goes around, because we trust, there's still that sense of trust within it coming from one of ours, that for a long time it wasn't, because when it came to medical, because we just felt that it was almost like instilled in us that the white medical health was the better health. And then we started hearing news about what happens, or experiencing our own experiences of what happens when you if the white health was not, did not want you there, but they had to tolerate you there. Just like with teachers and other, we see it in the education system with the kids too. So there's that. So I think it may have started with my generation, those who were born either under Carter or right before Reagan started. That was just like, maybe. Yeah, we start. It may not be all it's cracked up to be. So if where we can get them, we get them.
Mhm.
And so, and I have friends in Connecticut who they may live by New Haven, but they go to Stamford, which is for the traffic. That's almost like being in the next state
Yes,
because
yes, yes. I know. I know
the
the area. Yeah.
because of the drive, because of the traffic. So if you're in West Haven, you still driving to Stanford to go see a doctor simply because that was, that's a black doctor who, and then on top of that, I've been the best health, the best advice I've ever gotten was through that doctor. Once that doctor retired, she was devastated. Now she's at a, what do you know,
Mm.
like you say, you the Jefferson Network, but
It
their
was
appointments
a
are so
delightful
like you
conversation.
said,
She
they're
was very
overbooked, they're
thoughtful
overwhelmed.
and
So
provocative in
the
her
appointment's out
discussion,
till like March or April.
but clearly you can see that there
So
is a
right
need,
now, what I'm doing is
there
working
is a
still with
desire
my
for Black
doctors
doctors,
that I
and
started
there
with
is
in
a
Connecticut.
scarcity. I
Um,
like to spend the next
to where I
podcast
explained to
talking
them
about
because I explained to them like,
you
hey,
probably don't
in my
need that
PCP, the
annual
closest is in
GYN
December, and this was
visit.
me setting it up in September,
That's right, I
like
said it.
September, October,
That
right?
annual GYN
So
visit is probably not necessary. You should think of your gynecologist the same way you would think of a cardiologist. You don't see the cardiologist just because you have a heart. You see the cardiologist when you have a cardiac concern. Similar with the OBGYN. You don't necessarily need to see the OBGYN for annual visits. You should see the OBGYN when you have a gynecological concern or problem. But more about that next week. Stay tuned.